Hello, this is Dr. Dan Kohinka. In this portion of the Servant Leadership 2.0 Training and Development Program, we are going to discuss what it means to be authentic as a servant leader. The core value of being authentic includes honesty, where you tell the truth, you do not lie, or you do not withhold information, which is a form of dishonesty. Also, to be authentic means to be transparent, where you explain your decisions and actions and ideas to others. You're also accepting of others' advice and their ideas and opinions. It does not mean you have to agree with them, but you are willing to listen. You are willing to accept them as unique individuals that have their unique ideas, once again, even if you do disagree with them. Also, to be accountable is to be authentic means you are accountable for errors and mistakes that occur. And finally, you're self-aware of your actions, your behaviors, your motives. Arguably, if you're not self-aware, then you cannot continue to develop as a servant leader, and in this case, develop your ability to be more authentic. So let's look at some examples. One example that I like to discuss is where Minnesota State Senator and physician Dr. Scott Jensen, during the beginning of the COVID pandemic, reported the potential for healthcare fraud. At this very early time of the pandemic, that was not necessarily maybe proven yet. However, he recognized that it was going to be a problem. And so he divulged that. He stated that publicly. There was anonymous complaints to the Minnesota Board of Medical Practice, and ultimately they did an investigation, which resulted in, some obviously many challenges, both practical, where it perhaps impacted his medical practice, as well as, of course, psychological, with the stress for him and the family and so on to go through this investigation, which potentially was for political reasons. And ultimately, Dr. Jensen's predictions came true. As most people are aware, in America, there was fraud and serious cases of fraud across the country. After that, the Minnesota Board of Medical Practice very quickly dropped the case, did not publicly apologize or anything. And of course, by that time, Dr. Jensen had already gone through these challenges. Now, what's the point of this story? Well, he was honest, no matter what the negative consequences could have been, which I'm sure he recognized. He did not have to do that, but he recognized the problem, and in this case was also willing to address this potential problem. To be transparent takes on many different forms. In this example, there was an individual that made an error and injected Mary McClinton with an antiseptic rather than a marker dye. And as a result, she died. The leadership, the decision makers of the organization ultimately explained to the family and publicly what the cause of the problem was. And then they were willing to be accountable for their actions, of course. And in this case, they found solutions to prevent the problem from occurring again, which ultimately was spread across the country to other organizations who also adopted their plans to prevent the accidents happening at their locations, and ultimately it was adopted and changed national safety goals. To be accepting of others also can take on some different forms that perhaps you never even would have thought of because of political correctness or because of what social norms are, where something is said to be simply wrong because maybe it discriminates or something of that nature, when the reality is that there are different perspectives that people have and different ideas and so on, and to be accepting of those, whether you agree with them or not, is a behavior, of being authentic. So, for example, in the healthcare field, it's widely accepted when someone has cancer to give drugs, to do radiation therapy, or radiation treatment, I should say, to do surgery. However, it's debated to what degree that healthcare practitioners will discuss or even recommend religion and spirituality as part of this process of overcoming cancer or coping with it. even if it's terminal. And so research will show that religion and spirituality is extremely important in one's ability to cope with many different challenges, including health-related challenges like cancer. So to be accepting would mean in the healthcare field that religion and spirituality is treated just like any of the other forms of potential treatment that can help individuals. To be accountable for one's actions can also be challenging at times. For instance, if you have an intern who's being supervised by a physician and the physician is pushing them and letting them try to be more independent, and ultimately a patient needs some help that exceeds the capacity or the ability of that intern, and a mistake is made, whose fault is it? Who should be accountable for this action, this mistake? Is it the intern, or is it the person that's supervising them and mentoring them? Another example might be if there are staff cuts for budgetary reasons, let's say at a hospital, and then mistakes are made as a result because people, for instance, maybe are being overworked. Well, is that the administration's fault? Are they the ones to be accountable because they made all these staff cuts, causing people to work hard and be stressed and ultimately make errors? Or is it the practitioners who actually made the errors? Who is at fault? Who should be accountable here? And we don't necessarily have answers in this discussion. That's not the point. The point here is to demonstrate that it can be challenging, but ultimately the servant leader will be accountable. They will not blame others. They won't even perhaps debate it. They will accept the accountability. And especially in some of these examples, if they are a primary decision maker or a person of authority, even if they don't directly make the mistake, they will accept accountability for it because they were part of the decision that ultimately led to that. So another example would be if a division chief makes a poor management decision, resulting in staff making mistakes. Here again, the division chief as an authentic leader would take responsibility and be accountable for that error, as well as the staff who made the mistake. They would both, as servant leaders, be accountable for the errors. To be self-aware means that you are reflecting on your motives and your actions and your behaviors. What's interesting in healthcare is that as self-awareness in a study by Castro and et al. In 2017, they found that as self-awareness decreased, it led to poor and inefficient patient care. Things like clinical judgment, burnout also decreased when it came to personal accomplishment. Personal accomplishment is an aspect of burnout that decreased, as did patients' relationships with patients that decreased. Also, as self-awareness decreased, frustration among healthcare workers increased, emotional exhaustion and depersonalization, two other aspects of burnout, increased, as well as inappropriate use of resources also increased as self-awareness decreased. So here is some direct evidence as an example of why it's important to be an authentic leader, and in this case, to be self-aware of one's actions. Thank you, and once again, we addressed as part of the Servant Leadership 2.0 Training and Development Program what it means to be authentic as a servant leader.